daughter in Austin. Thanks so much for joining me today. This video is kind of part of a series about my Accutane journey. And the first video was kind of my decision why I pursued Accutane with mild but persistent acne. So if you're someone who does have that mild but persistent acne and you've tried everything, you might want to take a look at that video and check this one out too, and then any of the ones that follow, to see kind of how that whole process works and if this might be an avenue you want to pursue. So like I said in that first video, I talked about some of the reasons behind why I decided to go on Accutane. I talked about some of the risks that are involved because there are quite a few scary side effects, and it's really important that you're informed about those before you make your decision. And kind of where my feelings lied in terms of all of that and why I'm continuing on this process. So this video today is kind of a 3-month update, which ideally is the halfway point. I'm not sure if I'll have to go past 6 months, but this is the halfway point hopefully, and I wanted to share kind of the update and how it's been going so far. So currently I'm on a brand of Accutane because Accutane is actually, even though it's the household name that people know of, actually you're using the drug Accutane, and I'm on Zenatane, which is a certain brand of that. And I actually get mine mail ordered to me. You have to, when you go to get your prescription every month, females, you all have to take a certain blood test to identify that you're not pregnant and like making sure that everything is going well with you. And once that's okay, you go to your dermatologist for your monthly appointment. They check everything out, make sure everything's good, and then you go home, take these questions on I Pledge, which basically is you making sure you're stating that yes, you know not to get pregnant while you're on this drug. It's very, very serious. And then once you're cleared for that, then you'll get your prescription. So I get mine mailed to me after that point, but other people get the prescription and then they can take that to their pharmacy. So that's something to keep in mind. And actually a lot of insurance companies do pay for Accutane, so definitely keep that in mind, or at least a portion of it. So if that's an area of concern for you, make sure you do look into that, because a lot of pharmacies have agreements with that particular drug company. So definitely talk to your dermatologist about that. So like I said, I've been through 3 months so far. I'm into my 4th month, and the first month I was put on 40 milligrams, and then month 2 and month 3 I've been on 60 milligrams. So the first month I kind of expected my face to almost explode, because I know that a lot of people who have been on Accutane, their face just gets crazy exploded with blemishes and things, because it's really the drug working and trying to bring everything to the surface. I actually didn't really experience an explosion. In fact, my face improved a little bit right when I started. All these little small bumps I had on my forehead actually improved and smoothed it out a little bit. And as the other 2 months have gone by, that's only improved even more. So that's kind of been a really big positive. In month 1, really not too much happened other than that. In terms of side effects, it can certainly range so much for so many people. It could be as simple as dryness to as difficult as intestinal problems or joint pain and things like that. But for me, I've actually had an overall really smooth experience thus far. I've been really lucky with that. So with month 1, I had a little bit of dryness of lips, but I was able to kind of take care of that with some products, and I'll talk in another video about what products I've been using. But I will say that that dryness of lips has increased quite significantly for month 2 and month 3, so much to the point where I'm just really so frustrated with it. It can be painful because you really can't have any wax-based products on your lips during this time. That only makes it worse. So you're really limited in terms of products, but I found a couple that work for the most part. I was given a prescription for like a steroid based one that you can only use twice a day, and that's helped, but again, you can't use it all the time. So again, that's for another video, but that has been kind of my big side effect. So I guess if that's it, then I'm pretty lucky. So month 1 was pretty smooth, and I felt pretty good about it. Going into month 2, I was bumped up to 60 milligrams, so I took a 40 milligram pill in the mornings and a 20 milligram pill in the evenings. And you have to eat it with food because that's how it absorbs into your body. And I did notice a little bit of boost in that dryness, of course, and then to month 3, really dry on my lips, but really not too much on my skin, which is interesting. But I did also have dryness in my eyes. Only until the last couple of weeks has it's been pretty okay, but the last couple of weeks it's been really dry. So I might have to look into different eye drops, but I have been using those, and those do help. You might have to get eye ointment to use at night as well. So I'm definitely going to be looking into that more. But overall, like I said, the symptoms have been pretty good. In month 2, I noticed a lot of my blemishes were now emerging from underneath and coming to the surface. So that kind of showed me that this is indeed working. A lot of blemishes I didn't know were under my skin and my cheeks have emerged. So especially in these areas here, you can kind of see I do have some blemishes there on my cheek that I don't normally get on a regular basis before Accutane. So so that shows me, like, yes, it's working. It's taking all that stuff underneath the surface and bringing it all up and getting rid of it, which is nice. I've always had what's called milia on the tops of my cheeks, which are, I'm not sure you can see, the little whiteheads basically that are almost impossible to get rid of. I've had them extracted manually by my dermatologist, and she did mention in my last appointment that she might have to do that at the end of the treatment. So I'm not sure if that will go away with Accutane, but in any case, that can be taken out later. So I'm not too worried about those, but they're there. I think they're getting a little smaller, which is good. And I will say that the cystic-like acne I used to get on my chin has decreased, but I still get blemishes on my chin. So you can see here, I do have a lot of spots that are almost regularly always there. But that's pretty normal for me. So I'm thinking that because they're coming to the surface and they are improving and healing, that hopefully one won't grow in its place. So so we'll see. I mean, that's still frustrating, but my dermatologist said that the chin and the back, if you have acne, are the last things to get better when using Accutane. So, well, that makes sense. Going into month 3, not too much to change there. I've had a lot of ups and downs in the last 2 months in terms of skin. Like today seems actually like a pretty decent day, minus the couple of things on my chin. But other days I'll have more, and that can be frustrating. But again, I just kind of see that as this is a slow process, and it's going to take time, and I just have to push forward. So we'll see. I'm excited that I'm at the halfway point, but I'm ready to be done. The lips are really bothering me, and the eyes are starting to bother me, but nothing I can't handle, and those are kind of good toss-ups if you kind of think about the long run. And so I'm anxious to see what happens, and I'll keep you all updated through the process. So as I mentioned in that first video, if you do have more questions, I'd be happy to answer them. Just know that I'm not an expert in any way, shape, or form, and this may not be the right treatment for you. So I'm not advocating that this is for everybody, but for now it's working for me. We'll see if it works in the long run. I'm hopeful for that. But if you have questions individually, I'd be more than happy to answer them. So feel free to write them in the comments, and I'll get back to you about that. So definitely have an open mind, and I'll keep you updated on my progress. All right, thanks for tuning in. Can I find this all?